Grab a chamomile tea and a pillow because today we're talking about Luna, a tiny tubeless automated insulin pump that's meant to be only worn at night. It's used alongside insulin injections during the day, and it's meant to keep users' glucose levels in range while they sleep. Early results of the pump are promising, and it is headed to a pivotal trial before seeking clearance from the FDA. Welcome to the show. I'm Justin. I have type 1 diabetes, and on here I talk all things diabetes tech, news, and management with physicians, tech leaders, and those thriving with diabetes and using the tech themselves. Luna Diabetes says that multiple daily injection users, or MDI users, are missing out on the power of automated insulin at night, and they could benefit from this semi-reusable pump. The device is about the size of a Dexcom G6 transmitter. It is super small, and it only holds 1 to 10 units of insulin. You really don't need that much apparently, which we get into. This device comes from a group of medical entrepreneurs who have been part of the inception of other diabetes products, like the InPen Smart Insulin Pen, now owned by Medtronic, and Bigfoot Medical Smart Pen, now owned by Abbott. I spoke with the creator of the Insulin pen, John Showlund. He is now the CEO of Luna Diabetes. I asked him why Luna could be the next step in automation for MDI users or an additional device for pump users. I asked how the system is used, how its semi-reusable parts work, how users will interact with the system each night, and plain old why. Why should people use this entirely new category of medical device? If you haven't already, subscribe to the Diabetic Roundup newsletter and blog. On there, I throw articles every week and a newsletter every other week going over the latest in diabetes tech news and content coming out on our channel. Plus, we've got a community Discord that is for all of you diabetechies who want to talk to each other about all the tech. We've got channels for just about every category, so you can go over there. Both of those are free. Links to those are in the show notes. Keep in mind that anything you hear on this podcast or any of my pages is not medical advice and is for educational purposes only. Always consult with a physician before making changes to your healthcare. John, it is so great to have you on the podcast today. I heard about this product, Luna, at last ADA, and I knew I had to have you on the show, and I'm so glad that the time is now.
Hey, pleasure to finally be on the show with you and share a little bit about what we're up to, and thanks for having us. So thank you.
First of all, John, where are you right now? I see hard hats in the background. There's some sort of factory behind you or something.
Yeah, so we are in the manufacturing area where we're making Luna for our pivotal study, which is now up and running. So right behind me, you have a clean room. And in this clean room, we make the reservoirs or the infusion set for Lunas. And so not sure if you see, we have some of our Chloe and Miguel and others who are building those reservoirs. And then right in front of me, what you can't see is where we build the pump part of it and the chargers and everything else. So we're in the hub of Luna right now.
Wow, that is so cool. I would love to visit when the time is right in the universe. If there's an opportunity for me to come and get a sneak peek or first look and take people inside the making of Luna, please have me over. I would love to make that video. So I put out some feelers for Luna on social media asking people, what do they want to know about it? And I think the number one question I got was why? Why does Luna have a place in the market right now?
Sure. So insulin pumps have been around for about 40 years now. And automated insulin delivery, 6, 7, something like that. And for those of us who've been lucky to try it, insulin automation works. It's life-changing. And, really it was for a long time the holy grail of diabetes. And now we're starting to get, the first versions of it, and it's fantastic. So, however, most people around the world, and even in the US, which has some of the most forward with diabetes technology, is not using it. And so at Luna, our goal is to make automated insulin delivery more accessible, to get more people to use it. And we've rethought the experience of using an insulin pump and of using automated insulin delivery so that we can get more people to experience what it's like to have automated insulin delivery and what it's like to sleep through the night. So that's why we started Luna. because we want people to feel what it's like to go to bed and know that you're going to be okay and to wake up at target.
I know that adoption of insulin pumps is lagging quite behind continuous glucose monitors in this community. Why is that?
So in fact, there's an interesting ratio that answers this question. It's called the Aaron ratio, which is people that are using CGM and people that are using automated insulin delivery. And so at the moment, it's about 14% of people with diabetes that take insulin use an AID system. That's who Luna is for. You're willing to wear a CGM, but you're not benefiting from Luna. Yeah, so despite the incredible benefits of traditional insulin pumps or AID, the common reasons why people don't use them are, one, they don't want to wear something on your body all the time, whether it's tube or patch. I just don't want to wear this thing all the time. And not only wear it, 24/7, but have to wear it 7 days a week, every single day. Second part is that using an insulin pump today, they're complicated devices. Carb ratios, basal rates, insulin action time, insulin sensitivity factors. There's literally over 1,000 combination of settings on any of the available insulin pumps today. So not only is that hard for people with diabetes to figure out, but it's impossible for primary caregivers, which is where 2/3 of insulin-dependent diabetes is treated. And then the last point is cost, is that these devices are super expensive. And so whether, we think we've solved with Luna, solve for all of those things. So you don't have to wear it all the time. You don't have to wear it on your body if you don't want to. Drastically different price point and much simpler to use than a traditional insulin pump.
What is currently the issue for people with diabetes during their sleep that Luna is trying to address?
So as we started thinking about starting Luna, and if this was something we could solve, we started digging into the research about automated insulin delivery. Despite, me wearing one since around 2015, when I built the first, do-it-yourself pump, thanks to the work of Dana Lewis, I didn't realize just how powerful AID was at night versus the day. And so we started digging into the research, and it actually came from the Tandem pivotal study and Boris Kovachev's data, where we could see, and in this study, they compared wearing AID 24 hours a day to no AID to only at nighttime. And we could quantify this and show that 83% of the glucose improvement, or the increase of time in range, happens when you sleep. And it's predominantly because you're not eating. You're not eating, you're not exercising, and things slow down, and automation has a chance to kind of catch up. So even if you're using a pen and a basal MDI, almost all of the benefit of automation happens during the 7 or 8 hours that you sleep at night. So that was the aha moment for us, going, whoa, the overwhelming majority of all people use pens. Pumps are very complicated to use. They're expensive, and almost all of the benefit of automation happens at night. So let's solve for that.
How much time is being spent overnight above range for people
Got it.
that
Yeah.
you want to fix? Yeah.
Yeah, got it, Justin. So we've all learned to avoid hypoglycemia, of course, and that is a non-negotiable, right? We've all learned to avoid it, do everything we can to prevent it. But when you look at real-world data, and the one we cited, the largest real-world data that we're aware of is a CGM registry from Germany and Austria, and it shows that people on MDI spend about 4% of their night low and 40% of their night high. That's above 180 milligrams per deciliter. And that's type 1. In type 2, about 40% of the night above 250. So Luna was designed so that we do not cause any hypoglycemia, and we're very conservative to not cause more hypoglycemia, but really going after hyperglycemia. And so if we can reduce that 40% of the night that most people have hyperglycemia, and importantly, get it so you wake up at target every single morning, we think, and we know from our own experiences, that we're really changing people's lives.
Yeah, I myself have considered taking a pump break and going MDI. And I think my number one thing is, what about overnight? So I see the opportunity for me. I would love to have my AID pumps, but when I want to take a break, I want to feel a little more free having an MDI and then using Luna overnight. Before we dive deeper into Luna, I've got so many questions for you there. I want to get a little bit of an understanding of your background. I've only been in this whole industry for 3 years because I was diagnosed 3 years ago. So I don't fully have an understanding of all the work that you've put forth already and your other founders. Can you kind of give us a little lay of the land, some history of where you've been and kind of how you got to where you are today?
Sure. So, I mean, the founding story is I was diagnosed with type 1 when I was 4 years old. And so I've been living with diabetes, essentially my whole life. And thanks to my wonderful parents, diabetes was not a defining part of my life. I don't know how they did it because, man, I spend a lot of time thinking about my diabetes now, but growing up, I didn't. And I went to sleepaway camps. I've done the world's longest cross-country ski races. I've just lived a wonderful life with diabetes. But in my mid-20s or so, or late 20s, I just started to get really, really frustrated with the lack of usable, simple devices in diabetes. I remember the blood sugar meters that I was using at the time, and something would go wrong and say error 9 or error 11 or error 13. You're like, what the hell is error 13? You couldn't make heads or tails of this stuff. And I wanted a simpler way to manage my own diabetes and using pens. So my journey, I was working in advertising and working in technology, but my journey was creating a cap for an insulin pen together with my brother Andreas, and a third partner, Marcel, that told you when you took your last insulin dose. It was very simple. A cap for your pen that told you when you took your last dose. And I never meant to become a business, medical device entrepreneur out of it, but started showing it to people. People wanted more. And long story short, we sold hundreds of thousands of those across 40 countries. And then it was a simple on-off timer. My vision, and I didn't think it was going to become a business. So my vision to make insulin pens better and smarter was, how do you incorporate decision support into it? And ended up selling that company to Bigfoot Biomedical and moving my family from Sweden to the US as part of that, and created what became the Bigfoot Unity product that Abbott bought about a year ago. For me, it was about, how do you use design and how do you simplify diabetes to make life easier. And I really wanted to find ways so that you didn't have to put in so much work into your diabetes to get a big result. If you're willing to put in work, then there's products like insulin pumps that are really good. But you had to put in so much work to get the benefit. And I wanted to get benefit without a lot of work. I joined together with two other incredible people, John Brilliant and Sean Saint. John is one of the founders of WellDoc, one of the founders of Bigfoot. Sean, one of the founders of Companion Medical that made the InPen. And we're united by the fact that we think that technology has skipped over the masses. We've moved from insulin pens to insulin pumps, but over 90% of people that take insulin via, the MDI, type 1, type 2, are missing out on technology. And so our goal has to get more people to benefit from the advanced technologies that are in the market.
Yeah. Sean Saint came on the podcast. He's now the CEO of Beta Bionics, and he came on to talk about that. It was a great episode. He's so enthusiastic and great to talk to. But yeah, I totally see this area of the market for MDI. We've already perfected now with pens the ability to have smart insulin pens, but what about overnight when you're not using them?
So that's
it makes sense.
Between Sean and I, who, largely created that category of smart insulin pens, this is the next step. So how do you bridge that gap between smart pens during the day and automation at night when, nobody is in control?
Yeah, well, with smart pens, do you anticipate interoperability with your pump where they speak to the smart pen in some way to kind of gather information for how your pump works?
Yeah, so Luna by itself is very, very powerful, right? You're getting the benefits of automation when you put on Luna. But it's certainly not lost on us that if you connect it to a smart insulin pen, it gets even better. And so that's certainly, we know a thing about smart pens. That's certainly something that we're thinking about.
This episode is sponsored by Omnipod. So far this year, I've taken about 15 flights, so I know a thing or two when it comes to packing for type 1 diabetes. One thing I love about Omnipod 5 is that all the supplies come in one small convenient package. No additional packages to remember for tubing or infusion sets, which helps me travel with confidence and ease. See if you're eligible for a 10-day trial by visiting omnipod.com/diabetic. On there, you'll see full safety and risk information and trial terms. Again, that's omnipod.com/diabetic. With Luna, how will users interact with it? What is kind of the routine at the end of the day when they're going to use it?
So I think it's important to talk about the startup, and it's important to talk about the day-to-day use. So when you are new to Luna and you get this beautiful starter box that we're going to send you, made out of environmentally friendly packaging, you have to do one thing. You need to put into our app, how much long-acting insulin did I take yesterday? So whether that's Tresiba, whether that's Lantus, whatever long-acting insulin you're taking, you put into our app. I take 28 units. That's a number that people know because they did it the day before, and the day before that, and the day before that, and the day before that. You're not having to teach people about basal rates and carb ratios and insulin sensitivity factors, things that they don't know. So you enter that into our app, and then you're done. That is a whole setup of the whole system. We think it's our job to do the data science. It's our job to do the complex diabetes math that we all have to do, but it's our job to do that. You just tell us what your long-acting insulin is, and you're done. And you do that once.
Okay. And of course, sometimes my educator, when I was on MDI, I would go on vacation. My educator told me, hey, we're going to lower your basal. You're going to be super active. I assume, so you plug that in and it just knows that forever until you can adjust that if you're going to change it.
You can certainly adjust it. And when you change your basal, you can and should go into our app and update it. However, most people's basal doses are not titrated very well. And we see that from our clinical research and our data. And so we are very insensitive to errors in your basal rate. The algorithm is conservative enough to handle that. Not everyone has their basal rate their basal dose set correctly.
Okay, so does that mean also if I take my basal one day at 10 a.m. and I take my basal at 3 p.m. the next day, that won't interfere with Luna?
Will not matter. So long as you have basal insulin on board, you're just fine.
Okay. Will people need their phone beyond initial setup with the pumps they're putting on every night?
No. So, we need the phone to be around you, and remember that you're sleeping. The algorithm lives on the pump, but because you're getting CGM data and it goes via the phone, just like you need your phone for your CGM alerts, you need to have the phone around for Luna to work. It's part of our safety mechanisms and the design of it. Just in the nights that you need to use Luna, and this may not be every single night for all people. And that's the beauty of Luna, is that because it's additional to MDI, if you have a low carb meal and you ate at 6 p.m. and you know that your bolus dose is titrated well, you may not need Luna that night. Then you don't put it on. But for the nights that you need Luna, you take the same rapid-acting insulin that you use for dinner, and you fill the Luna reservoir with it. So you don't need to get a new prescription for a new vial of insulin. We don't have to send you a syringe that costs a bunch of money. You just fill it from your insulin pen. And, as we were designing this, is a question like, why don't all pumps work that way? Why is it so complicated to fill insulin pumps? Why not fill it with your pen? So you do that. And then what you do is you take the pump and you snap it into the reservoir. But the important part of that, Justin, is that when you connect those two parts, that's when we know that you've you're starting to use Luna. So we check that there's insulin, we prime it for you. You don't need to take out your phone and do anything. You just fill it and put it on. Justin, by separating the insulin pump from the reservoir or the infusion set, you get two big advantages when you use Luna. First of all is that when you connect them, we know that you're starting to use Luna. So we check that there's insulin, we prime the device for you. You don't need to take out your phone and do anything. You just put it on. But also in that design, we've separated the expensive parts, the pump, from the inexpensive parts, the reservoir. So that's how we lower costs and make the device much more accessible and meet our goal to make automated insulin delivery much more widely used.
Okay, interesting. You know, what you said about not needing to wear Luna every night, that's so true. This is such a good, for MDI users, some nights you go to sleep and you know you're going to be fine. You didn't have any crazy foods that night. You know, your glucose levels will probably be okay. But there were nights when I was on MDI when I would have a burger and fries and be like, well, glucose levels are probably not going to be that great tonight because things, it's going to absorb into my glucose levels while I'm asleep and I'm not waking up in the middle of the night to fix this. But on nights like that, that's when I could, throw on one of these, be like, all right, this is what I'm going to use it. And it kind of, there's like a cost savings in that too. You can kind of use it on your own time. So that's cool. Why didn't you include the ability to log the last bolus that you took?
Yeah, good question. And it's just because we don't want you to have to do more work. If you have to go into your app, log when you took your dose, what you took, when you ate, it's creating a lot of work. And we have in our simulator, we've gone back and looked and see what happens when you do that well, what happens when you do it partially well, and what happens when you don't do it or forget it. And it's our belief that the benefit of doing that, the benefit to getting you, increased time and range or a little bit quicker is just not worth the risk that you do it incorrectly, you enter wrong data, and it's just a hassle. But we want no work. And our app is designed to never wake you up, ever. We want you to sleep.
Yeah, and I can imagine that because you're not taking the information of a bolus that could have happened, 30 minutes to an hour just before the putting on Luna. Is there some sort of run-in period when you put the pump on that it's, kind of gaining information and figuring out what it's going to do? What does that kind of look like?
Yeah, that's an important part of it because we do not know anything about what you did before you put on Luna. We don't log anything. We don't ask you food or bolus like we just said. We don't even know if it's been 2 days since you wore it. So really the big innovation for us, besides making the world's smallest patch pump, was this algorithm that we've developed, which handles the night differently at the beginning, at the end, when we don't know what you did versus when we do know what's been going on.
When you say that, do you mean that you have a part of an algorithm that could take into account insulin on board, fast acting, if that was somehow, like that information was fed to it somehow?
That would be possible to do, yes.
Okay, so would that require a new algorithm, or is that like that your algorithm can kind of handle that if you were to implement it? Obviously, studies would need to be done, but
yeah, well, it would be a different. I guess you'd say it'd be a different algorithm because there's other inputs. What we're doing now is a transitionless, no input algorithm that's completely hands off, full closed loop.
Okay. And so this insulin pump only has 10 units, which is part of the reason why it's so small, I'm sure. That's not very much of insulin. Can you kind of speak to that?
Sure. Let me ask you a question. So remember, this is additional to the basal that you already have on board. So for the average person with type 1, how much additional insulin do you think they need? Remember, you're spending 40% of your night in hyperglycemia. On average, how much insulin do you think you need, rapid acting insulin, to get you to target in the morning?
Well, I know the answer because I did my research.
Okay,
so I'm gonna say 1.7 units.
at 1.6.
Oh
1.7,
my goodness. Wherever I read that was wrong. I'll
no,
find it for you. We can,
you're right, because 1.6
okay.
comes from our simulator at a population level, but 1.7 is what we used in our what we had in our last study.
Okay. That's
And it
not
was,
very much insulin.
it's not. And that's really, that's another kind of aha moment that we had of like, whoa, um, it doesn't require that much insulin. And we had people in our studies that have been, at 300 and starting the night at 300, and we'll give them 2.6, 2.7 units and get them to 120. And so it's just not a lot of insulin that is required. And so 10 units gets you to all of the type 1 need essentially, and almost all of the type 2 need as well. So it's pretty powerful what you can do with just that amount of insulin.
Wow. Yeah. I've seen the Omnipod up close and personal in their R&D department. I built a pod and I saw how much room the 200 unit chamber takes, how much room the needle retractor takes up in order to put a cannula in your skin. I know, this one doesn't have that huge chamber. This one doesn't have this huge mechanic that is inserting a cannula. This thing has the ability to be much smaller because of that. Oh, this thing is only being used, once a night. It doesn't need those 3 little batteries that Omnipod has inside of it. Explain to us what the pump looks like, kind of, and for my listeners especially, what that size is. Feel free to compare it to something we use every day.
This is what it looks like. It's about the size of a G6 Dexcom G6 sensor, if you remember that. So this is the pump side of it, and then you'll have the reservoir that attaches to. It's really small. And Justin, as we were designing this, our design goal was to make it as similar as possible to you taking an injection with a pen. So if you are familiar with the tiniest pen needles, they're 4 millimeters long, they're 32 gauge, they're tiny. And that's what we use in our device also. And so I understand that I'm biased, but when I look at it, I have that kind of aha magic experience where I look at it and I go, whoa, that needle is tiny. And so that was a big part of why we decided to not make an applicator for it. And we designed one originally, but as we started showing it to people and doing testing on people, we asked if they wanted an applicator after they'd applied it. They said no. And what was interesting is the reason people said no was the environmental impact that diabetes has. And they said, I'm able to apply this. It feels, like a pen needle injection. And remember, you're using it once, unlike most people in pen needles who, and I don't recommend this, but are using that same pen needle 10, 15, 20 times. You have a fresh, perfect needle, so you don't even feel it. And therefore, when asked about the applicator, they said, we cause so much waste with our diabetes. So if you can have one less device, one less thing, sign me up for that. And that's why we decided to ultimately not even send an applicator, because you don't need it. You hold it in your hand and you put it on wherever you normally take an insulin injection.
Okay, so what are these components you have? Walk me through that step by step of, moving the pieces together and putting it on.
Use your own rapid acting insulin pen that you used for dinner. Fill it in our reservoir. So dial between 1 and 10 units of insulin and fill it up and attach the pump to it. Lift it up and put it on your body. When you lift it up, the adhesive is already exposed and peeled off. It's ready to go. So you lift it up and you put it on. It's really simple. Fill, attach, apply.
You're saying this thing can hold as little as 1 unit of insulin. Wow.
This is about going to bed and knowing that you can sleep. This is about going to bed and not getting alarms and alerts from your Dexcom because you're too high. This is about not having to go up and pee because your blood sugar is too high. This is about not waking up at 2:20 and starting every single day or most days on the diabetes roller coaster. This is about smooth sailing back to target every morning. So you're starting your day fresh, you're starting your day ready to go, and you're thinking about getting dressed, eating breakfast, getting to work, getting to school. and not dealing with a diabetes roller coaster again. We want people to sleep.
Yeah. So this pump has this small little needle the size of the insulin pen needle. You're just pushing it on yourself. How does this relate to scar tissue? Scar tissue is a real thing when it comes to insulin pumps. The cannula on those pumps or needles are much thicker and larger, and they stay in for 3 days. So scar tissue is a very real thing. Is the problem of scar tissue like kind of eliminated with this system? Is it not something you really have to worry about as much just because of how small it is? What are you seeing there?
Yeah, I'd think of it as just another pen injection. So just like with pen injections, where you need to rotate your injection sites, you need to do the same with Luna. And that's where you can wear it where you normally take an insulin injection, or maybe even in some other places that you wouldn't normally do it, but it feels okay when you're sleeping to put it there. So it's another pen injection.
Today's episode is sponsored by T1D Exchange. You can directly make an impact on diabetes healthcare, treatments, and technology by participating in the T1D Exchange registry. It starts with a simple survey about your life with T1D, and it only takes about 15 minutes. After that, you'll have a personal portal with ongoing T1D study and survey opportunities. Plus, some of these studies even offer compensation. Signing up with the link in the show notes helps support my channel, and it allows me to continue putting out free content. You can sign up at t1dexchange.org/diabetic or click that link in today's show notes.
The adhesive on Luna, you're only wearing this for, some people sleep 6 hours, some 8, some are lucky to sleep 11. But because the adhesive is only for a short period of time, we have a much gentler adhesive than you'd have on other pumps or on a CGM set. And so that's really different, right? Because its job is to hold it for, 10 hours, max of 12 hours is how long the device works. So that's an important part too, where if you're just not loving the adhesives and ripping those off every 3 days or every 10 days with a CGM, much gentler.
And now charging this, there is one piece that is reusable, right? The electronics, is that a piece that you're charging every night? How does that work?
You use this episodically. You only use it at night. When you wake up in the morning, you unattach the reservoir and recycle that, and you put this on, this beautiful charger that we made. It looks like a cool bedside, it's a nice looking device that you snap it into, is a nice magnet, goes onto, and then when you're going to use the pump the next time, that evening, take it off and ready to go. So it charges really quickly, but we want it to be convenient. We want it to be in a place that you don't forget where it is, and make this experience super easy. So you drop it on the charger, starts charging.
You're charging it on that wireless charger. Did you consider USB-C as a charger that would go directly into the electronic? What was your thought process behind that? Just because, it's nice. It's easier to just find a USB-C lying around or taking it on vacation. I have a USB-C that charges my phone, my laptop, my headphones, my Omnipod PDM. Why not just implement a USB-C port into something that I assume is not getting wet? Why didn't you go with that route then, and you went the route of charging it on a pad?
So our charger does take USB-C, but the reason is the size of the device. So if you have to incorporate a USB-C port and the electronics to handle charging via USB, it gets bigger. And then when your thing is this small and it's tiny, it makes a meaningful difference. And so that's the reason. Waterproofing is another one, but that's doable.
Yeah. What is the battery life on the Luna? I know you want to charge it every night, but have you tested this thing actually lasts 3 nights? Someone could probably reuse this on a 2-day weekend trip. Is there a world where I don't have to take my Luna dock on a weekend vacation, a two night vacation?
Yeah, it'll work a couple nights. But if you think of like an Apple Watch, if you have one or worn one, where you charge it every day, we think it's much easier to remember to do it if it's every morning when you take it off, put it on the charger, take it back. So you never run into this situation where it's not charged when you need it. It will last a couple of days, but the charging cycle is put it on every day and just do it. So it always works
Yeah.
if and when you need it.
I guess the reason I'm asking all these questions about charging is I forgot my insulin on a trip. There's always room to forget something, right? So I love the ability for devices to have a backup solution. Oh, you forgot the charger? Don't worry. In this case, you can't use a friend's charger. I assume it's a proprietary charger. It's not Qi charging, is it? Which is like what we charge with our phones.
Yeah.
No, it's proprietary. So, if I forget the Luna charger and it's charged, I have one night. But I like the idea of that backup. Will people only get one electronic? Do they get two in a package? Have you thought about maybe users should get two of them as their yearly whatever, their yearly package?
Yeah, we're still figuring out how to
Yeah.
bring it out. It's remember that this is different than an insulin pump, and if you were to forget this on a trip, unlike if you forget your insulin or you forget your CGM or you forget something where you have a world of problems, you've got diabetes problems, and you're probably going to the hospital when you land in Fiji for your trip or whatever you're going. This is additional to MDI. So if you forget it, or if you don't want to put it on, or you forgot the charger, you're right back to the everyday previously with diabetes. You don't have the risk of DKA. You don't have all of these problems. And so that's an important part of it too.
Earlier, you said that you take the electronics off the reservoir and you recycle the reservoir. How is that reservoir recyclable?
We're working on that. That's to come.
Speaking of recycling, the environmental impact. That's a number one thing that I think about when I think about it, but I still use the Omnipod, which feels like it is just wasteful, and it doesn't feel good using Omnipod in that way, but I still use it. But can you kind of compare the environmental effects with your product and kind of how you've learned from products like Omnipod or even the tube pumps? There's so much waste. How have you kind of worked to lower the waste with your product?
I live with diabetes. My two co-founders, Sean has diabetes, John has a child with diabetes. We live with this stuff. We've seen the pictures of, holding up the applicators for CGMs and infusion sets. This is our lives too. So we think about this from packaging. We think about this from how tightly you can compress these together so you get more in a box. And specific to the device, an important part of it, this is the pump is reusable. So you're not throwing away the batteries. You're not throwing away the electronics. You're not throwing away the motor. You're using it for a year or two. And so that's a really important part of our story of not only does it lower costs, which is good for all of us with diabetes, but it's better for the environment. And that's really, an important part of what we're doing.
Yeah, I would like to see other pumps follow suit in the tubeless department, especially as other companies come in. Let's get into the pivotal trial. But before we hop right into that, I want to hear a little bit about the pre-pivotal trial, which you completed in February 2024. Can you kind of tell us about the work that has been done so far with Luna with that pre-pivotal trial?
Yeah. So even starting before this, what's really hard to show is the incredible amount of simulation work that we have done. So we have developed what we think is one of the industry's most advanced metabolic simulators. And it starts with the fantastic work of Lane Desborough, who started his diabetes career as Medtronic Diabetes and made some of the first predictive low glucose suspend pumps. He started the We're Not Waiting movement, was part of the team at Night Scout, an incredible guy. But behind this incredible guy is a remarkable control engineer. And so he has made multiple generations of simulation capabilities and helped with our first one. So this is a really, really, really important part of our story because we use it to not only develop algorithm candidates, but we use it to run tens and hundreds of thousands and million nights of simulation to see what's going to happen when you do this, when you don't do this, what happens if you have too much insulin, too little insulin, just every possible thing. So before we put this on anybody, we know so much about how the device is going to work and what's going to happen. And so our clinical studies for companies like ours are not as much about learning what's going to happen. It's confirming what we already know. And so our pre-pivotal study was confirming it worked the way that we thought it was going to work. And so we are going to be publishing some of the data coming up at ATTD and presenting that data. So somewhat limited in what I can share about it. But the way that it works is this is a safety study. So you put the device on people, they sleep at a sleep clinic or at a hospital, they're monitored by doctors and nurses, and they wear Luna. And we were thrilled with the results. It confirmed, like I said, we predicted 1.6 units of insulin and ended up being 1.7. It met what we thought was going to happen. We had not one instance of hypoglycemia when we delivered insulin, and we got people to target and pretty significantly increased time in range. So the headline is Luna works, and the headline is automated insulin delivery for pen users can be done.
Wow. And now you've got this pivotal trial coming up. Walk us through that. What's that going to look like?
Yeah, so this is the last major hurdle before you submit everything to the FDA. It's called a pivotal study. And the way that it works is we're going to take, we need 120 people who are using pens to wear Luna out in the wild. They're not sleeping in a sleep clinic. They're getting the device, going home and living their lives as they normally did. And what we're going to be showing is the improvement to time in range compared to before they started using Luna. We're going to be doing it across probably 8 sites across the US. We started at the Barbara Davis Center in Colorado. We're about to launch our second site pretty soon. And what's really cool, Justin, is that we're the first study ever approved by the FDA to use time in range as a primary endpoint. So a success for us is increasing time in range at night compared to that person as their own control. And we're the first study ever approved by the FDA to do that.
Do you think we'll be moving away from A1C being the determining factor and focusing more on time and range, which kind of tells us a little more information about our glucose levels?
I do. It's a better endpoint. It shows better data. A1C has been very valuable, but we now have better tools.
So Luna, your main target right now is type 1 diabetes, right? What is that movement? Are you going to move over to type 2 diabetes? Do you need a new algorithm for that community? Kind of what's your pathway for that?
Yeah, you need to do a different study. And so the reason FDA wanted us to start with type 1, we'd originally intended to do a mixed type 1 and type 2 study. And the Luna product is well suited for type 2. We don't envision a new algorithm. So we're starting with type 1, getting to the starting line, and then hoping to rapidly bring it to type 2 thereafter, because that is a huge need. People with type 2 that look and feel similar to type 1, so basal bolus insulin on MDI, is larger than all of type 1. And they are totally missing out on technology. And so we can really help a lot.
When do you expect Luna to release? Kind of what does that pathway look like? What's left to be done, and where do you see that coming?
As quickly as we possibly can is the answer to your question. And so we have our pivotal study ahead of us. That's going to be middle of 2025. We're hoping to be done with that. And then it's the process of working with the FDA to get the device cleared. For some companies, that's 6. For some, it's 9. I've been burned in the past by promising timelines. And I think it does a disservice for people who are waiting for this product to come because it's so hard to predict. So what I can assure everyone watching this is that we are truly doing everything in our power to do this as quickly as we can.
Have you considered using Luna with other hormones, other therapies? Glucagon, using it as not something that keeps you from highs, but keeps you from lows, which is something people really worry about at night.
Justin, I can't tell you all of our secrets.
Okay, well, that maybe that said something just by you saying that. But yeah, I mean, I can imagine that there are other medications that I don't even know about that that need these little fraction amounts that Luna could be used for. So I'm hopeful that there are other ways this technology can be used.
There are. And look, we know diabetes really well because we're living with it and we intended to solve this. So we know diabetes well, but we have certainly been asked for other if we can do other medications that require a tiny, lower cost device like this.
Well, I wanna end off with the DIY community. You mentioned that you yourself built your own DIY pump back in the day. It's an incredible community. What inspiration have you taken from the DIY community? What is your connection to that community?
I mean, I'm in it myself because I use some of those products. I'm supportive of it. These are my close friends that I've known for many, many years. The difference between, this is my opinion, the difference between a company and the DIY community is that companies have the opportunity to make the products that we're making much more widely accessible. And it is, it is the case that in order to get a primary care physician in Oklahoma to write a prescription for your device, it's got to be cleared by the FDA. And so I'm a huge fan of I'm part of the open source community. I'm a fan, I'm a believer. I'm helping organize the Diabetes Mind Conference because I believe in it and I believe in the innovation and we're learning a lot. But I also believe that there's only so many people that can use those products and be helped for it. And my goal is to really supercharge how many people can benefit from this stuff. And I think it requires it requires clinical data, it requires products to be reimbursed, and it requires FDA clearance or clearance from other regulators in other countries.
Yeah, well, it's great to have someone like you who's got that connection to the community working on something that will be FDA cleared, just bringing those ideas in and those connections. John, thank you for coming on the show. This was so interesting, and I cannot wait to see where Luna goes. And I'd love to stay in touch with you and maybe have you on the show again when things get closer. And I'd love to come visit sometime when the time is right to give people an inside look at kind of what you have going on over there.
It's really my pleasure. And, thanks for getting the news out about the work that we're doing at Luna and others are doing to make diabetes just suck a little bit less. That's really what this is all about. So we appreciate it. Thanks for having us.
What do you think about Luna? If you are a pump user, would you replace your entire system and go back to MDI with Luna? Or would you consider this an additive product? And if you're MDI, let us know what your glucose levels look at night or how you feel going to sleep without an automated insulin pump. Would you consider Luna? Let us know in the comments on YouTube. I'm excited to hear what you think. Also, we've got an end of the year survey for the podcast. I want to hear from you what you like about it, what you don't like about it, how can we be better? I want to go back into 2025, a stronger podcast with your support. Thanks for watching. As always, I'm Justin, and I'll see you next week.